The warmth of a hand in yours, a single frame captured with the people who matter. For most, these are just moments, until they become the only thing that counts. We often think survival means enduring the unthinkable. But what if the goal isn't just more time, but better time? Finding peace in the life that's left. I'm Wendy, and this is Hidden Hustles. So Dr. Neo, I noticed that you talk a lot about the human aspect of what it means to be in the ICU. I just want to understand, why is this mindset so important in the ICU?
In the ICU setting, when a patient gets hooked onto a machine, the patient turns a little bit depersonified. And this disruption disorientates the family member, and all they can see is this current crisis that overwhelms them, and they can't move on. We come in with a humanistic aspect to try to help them better understand what does treatment mean to this patient. And as family members, they are held ransom by the fact that they want to hope for the best, and they also have to prepare for the worst. We don't judge these emotions, but we empathize with these emotions, and we know where they come from.
What I saw really challenged what I knew the ICU to be. It got me intrigued at how two traditionally opposing approaches can exist in harmony. Later that morning, I sat in on the team's huddle before they headed out to see their patients for the day.
We will go and see another patient. He has cancer, which makes swallowing a bit difficult. Mr. Ong! 哦，看可不可以喝咖啡？看汤匙嘴巴，对了。So like a cheerleading team, which actually we also trying to do so. 喝一下，喝，OK， 放松。什么事？ So suddenly there's a change in his demeanor. We're trying to find out what happened.
哪里痛吗？没有，那皱着眉头干嘛？
放松。阿公，为什么脸皱皱？
眼睛开起来。
Hello， 阿公。
没有开嘞，眼睛没有开嘞。
睡觉啊？昨晚有睡觉吗？有啊，阿公睡醒了。
So am I right to say your team comes in as an additional help to the teams that are in the ICU?
We view ourselves as a cogwheel in the whole machinery, a cogwheel that's crucial to link different parts together.
Perhaps another way to look at it would be we are the constant during the multiple change that the family and the patient might have to go through during the hospital stay. We'll bring them some comfort in transiting through the different settings, different environment, different teams.
Ajik, we take photo, okay?
And it was quite rare that something like this happens in the ICU, and I was grateful to the family for allowing me to observe their moment. And honestly, I realized how precious these moments are.
Nice. Very nice. Shall I bring Pachik more to us? Just help me watch the ETT, yeah? One person, one side, huh? Very nice smile just now, okay? Very nice smile. Even the baju same as Papa. What happened?
My handphone.
Oh, what happened? Relax. Relax. Okay? Relax. Yeah, we will help you find, okay? Meanwhile, now very important, we finish this one first. Okay, take photo, yeah? Okay? We're going to change the breathing tube to the oxygen mask. Then maybe we can take again the photo without the tube lah.
Okay.
How about that?
Okay.
Can? We're trying to manage a bit of the emotion. Is my opinion, right? Making sure that they have together
So we try and facilitate it as much as possible and seize the opportunity to take as many shots as possible. Okay, you might want to just apron up. We are going in shortly to remove the braiding tube.
Okay.
Okay. So what I'm doing is checking the alarms to adjust it according to the patient's condition. Because the alarms are very loud. It'll be very scary for the family members to be outside and then hearing alarm, then fear might overtake their mind. So these are unnecessary anxiety and stress that we hope to reduce.
Can I help you?
Yeah, I can help you.
Maaf saya ha, sorry ya.
Okay, okay. Okay, almost done,
Okay, it's a lot of
Strong
them.
cough,
Yeah, you help me throw this. Yeah, this one. Yeah. That's okay. Wendy can help me clean his mouth first. Clean around the teeth.
Around,
It doesn't hurt.
around the teeth.
Yeah, just like
not the
that.
mouth,
Go
is it?
around the teeth first, because you remove the phlegm. Then after that, you clean around the lips.
Okay.
Yeah. Okay. You ready?
Okay.
Yeah. Just keep it. Yeah. Just like from the side. How you will brush your own teeth. Yes. Yeah. And now you can take more care to clean around the lips.
Okay.
Then you're removing phlegm, is it?
Okay.
Yeah. And now just wipe it off.
Okay.
That's it. Then once Dr. Ong and I are satisfied that it's okay for the family to see him at this state, then we will let the family come back in again. Yeah. You think it's okay? Alright, if you think it's okay, we let the family come back in.
How do you usually guide the conversation regarding grief with the patient's family?
I think grief is a very personal expression. Everyone, each of us deals with grief differently. On the other hand, I like to redirect the conversation to the personhood of the patient. So I'll go by saying something like, tell me about mom or dad. They will feel that you see my loved one as a loved one, my loved one, not just a condition, not just another patient, not a bed number. Okay, we took out Papa's breathing tube, we put a mask on the face, so then we can go inside and take more photo with him. Nice, come. Okay. So that one is the oxygen mask that I was saying. Makcik, dia just ambil gambar.
Like, mom doesn't seem like she wants to be in the room.
This might be her protective mechanism. But what is interesting is she keeps telling the daughter, do not cry, do not cry, do not cry. So we have to actually gently let her know it's okay to cry because the daughter will need her space. When I'm standing here, I also want to make sure that the patient's dignity is being protected. How would he wants to be looked at? Yeah.
Before palliative care was introduced in the ICU, how was that environment like?
we're very focused at doing everything, all it takes to save. A lot of time it involves painful procedures. And if time is of the essence, we don't really think about how the patient feel during the emergency to save life. Pain and comfort is a acceptable trade-off in the earlier days. I'll be honest, fracturing ribs is a known complication of CPR. I do wonder, am I doing the right thing? And why am I cracking this old man's ribs? And the worst thing is, if he were to pass away, if I cannot revive this patient, then we are the last person that the patient see, a stranger.
So is there a difference now?
The difference now is I do get to hold their hand, help and guide the family through this final phase of life to really show them that yes, we are grieving and we are anticipating loss, but it doesn't have to be overwhelming. It can be a very precious shared memory among the family, and that death is not that scary. It doesn't stop our love. It's just a continuity of a love in a different form. Yeah.
Okay.
The night shift nurses actually found the time to do this mold with the patient and the family members. It involved repositioning the patient and then allowing the family members to hold their hand. If palliative care is introduced at only the last phase of life, we miss a lot of opportunity to do other meaningful work, example like this. The patient has suffered irreversible brain damage. Yeah, so the family is also considering the withdrawal or life support. There we go.
You were saying that this is a patient and their child, kids.
So you imagine the son is actually holding, embracing the mom's hand. Right, like that. See? Talk about it, I get goosebumps. This is a very, very private and loving moment. Yeah.
I don't even know how, I can't even really describe what I'm feeling. I feel like it's
A bit overwhelming.
it's like I understand why it means so much to the person.
So personal story, this room was the inspiration for this whole hand mold initiative. Yeah, my patient was in this room, husband and wife, very loving. So their code is they'll hold hand and sleep, and then the husband will ask the wife, "Are you okay?" And she will, "Okay." Every morning, he wake her up, and then she will tell him, "I'm okay." You know, so this is their daily routine. But we were seriously talking about withdrawing life support already. So all he said is, "How do you expect me to agree? Because by saying yes, I will not be able to hold my wife's hand anymore. How do I help him hold the wife's hand?" If on this one?
I think it's quite something. I was just wondering, like, with palliative care introduced, does it alleviate some of these burdens that the healthcare workers also go through?
That's what we hope to do, be a safe space for both ICU clinicians and family members to share their emotions or their views. And sometimes all it takes is just a pat on the shoulder saying, that must be very tough. Wow, you guys had a difficult time. It's so challenging.
I was just wondering, you being in this environment for so long, like, how do you deal with all those emotions?
I can care without taking the burden of these pain and suffering. At the end of the day, being able to compartmentalize that this is work, I can feel fully for them. But once I'm out of that room, out of that situation, I do need to recalibrate because the next patient will need my help and the next patient will need me to be equally present. And once out of work, I owe it to myself to be present for myself and my family.
Spending time with Sister Fiona showed me how Palcare looks like in action. And I wanted to make sense of this concept of death. So I checked back in with Dr. Neo.
Okay, gonna give you something to help you feel a bit calmer and more comfortable, alright? Yeah. Okay, you're doing fine. Mr. Chua, we're going to remove the tube for you already, yeah? Okay?
When we first met just now, right, then you quite accurately pointed out, oh, you look tired today. like you seem like you're in your head a lot. It was a very accurate assessment, I must say. So it seems like this is very intrinsic to you. Like
Yes.
just looking out for people and just sensing the room and seeing how they feel. Yeah. Working in the ICU, you cannot not engage your heart. Then are there any challenges that you face but maybe the public don't necessarily see?
So we do see a lot of suffering on a daily basis, physical suffering, emotional suffering, both from the patient's perspective as well as the family member's perspective. Do we have, for example, what we call empathy fatigue? We can sense the pain and suffering, but we also orientate ourselves. We do not assume that this pain and suffering is ours to keep. You know, they have their own journey. It's not me who led them to this stage, but it's my job to journey with them till the end. The likelihood is that if we were to remove the tube, he wouldn't survive for too long. It may be a matter of hours or short days before he leaves us. So I understand it's really challenging for us to discuss this topic. And it's very brave of you to remain in this room to even discuss with me.
How do the healthcare workers navigate these decisions when the treatment is possible but not necessarily maybe humane or done in the most humane way?
So this decision about when is it time to let go. In the ICU setting, we always err on the side of life, but when the probability is stacked against the patient and the expense is a lot of suffering, is that process of going through all these life-sustaining treatment overly burdensome and painful. We'll have to engage the family member and conjointly decide whether continuing burdensome life-sustaining treatment is still worthwhile. And this weighing should never be just handed over to the family and said that this is option A, option B, option C in terms of aggressiveness. You decide. Yeah, that should never be the case.
Palliative care coming in is not a signal of the end, right? Because I know when people think palliative care comes in, it's like, that's it, we've given up hope, this person is dying.
Exactly. We now want to promote palliative care much earlier so that we have a longer runway to institute all the physical, psychological, social, functional and spiritual interventions and for patients and family members to benefit.
In that case, how do you make peace with the limits of what medicine can do? Is there such thing as a good death?
Defining what is a good death, we almost look at death as a problem, as if there is a good solution to a problem. But we miss the point that death is actually a natural phenomenon that needs us to accept it. And that is important because the feeling that life has been meaningful, life has been worthwhile, makes you less afraid of death. It makes you not need to worry about the question, is life worthwhile and worth living for?